Dr. Amy Youngblood from Southern Indiana Equine. We are going to do a demonstration today on an equine dental procedure. February is Pet Dental Month, so our clinic offers 10% off of small animal as well as equine dentistry. So dentals and horses, or teeth floating as we call it, is such an important thing. Surprises me how many people do not address their horse's mouth, and especially performance horses that we're asking to work hard under pressure, and that people will do chiropractics and several things before they'll actually look in a horse's mouth. Almost every time at a horse show, I see so many horses head shaking, having issues with the bit, and 9 times out of 10 these horses have issues in their mouth. So we're going to use this skull just to show you what you can't see from the outside of a horse. We can see a little bit better looking at the skull. Horses have, well, she doesn't have all of them, but horses have 6 incisors across the front, on the top and the bottom. Incisors are sometimes often forgotten about. In this horse, you can see that she has a little bit of a natural overbite where my fingers are. And in a horse, that right there on an overbite will create a hook that hangs off of that front premolar that we see frequently with this kind of thing. So horses have 3 premolars and then 3 molars, complete sets on both sides. 36 to 42 teeth total. Wolf teeth will be present right in this area. And then usually in geldings and not mares, although that's not always the rule, they will have bridle teeth, which we put a bit in a horse's mouth. And this could be better demonstrated if I could show you this with the gum tissue, but we've got a bit in the mouth. We have all this gum tissue between the bit and that first tooth, and then we're applying pressure to the reins and pulling back. You can imagine how when this tooth here is sharp, how much pain that can cause the horse. So we will put in a horse's mouth what is called a bit seat, which is a rounding of this first premolar here and a rounding of the one on the bottom, to where when the bit sits in and pulls that cheek tissue, that the horse is comfortable and doesn't experience discomfort with us applying pressure to the reins. So that's the first premolar. The cheek teeth here can get pretty sharp points. This mare had been floated at some point before she passed. Her mouth is not bad, but you can see back here in this back molar tooth a pretty good enamel point that comes down. Those can go ventrally, they can go out to the side, and they can cause significant ulcerations in a horse's cheeks, which are actually divots in the tissue. You can actually feel like holes in their mouth. So those are the biggest things that we're going to address. The outside of the upper teeth and the inside of the lower teeth are what we're going to mainly address with the float. Put a bit seat or a rounded on the front premolar here. Remove any wolf teeth that are present. Training horses, 2-year-olds, we're asking them to learn how to do all this and to give and to be soft. When they've got a wolf tooth there that hurts them every time the bit hits it, you can imagine how that feels and why we have some issues with them. The other thing in young horses, 2-year-olds and 3-year-olds specifically, is caps. These first 3 teeth have baby teeth versions of them. So when the adult teeth come in, they push the baby or the deciduous teeth out, and that will leave a cap on the surface of that tooth. So those caps can be really sharp. They can get loose, they can fall out, and they can certainly cause problems, especially in a performance baby that we're trying to get broken and get trained. So those are the main things. Enamel points, caps, wolf teeth. Bridle teeth here can get very large and very tall. They can interfere with you getting the bit out of your horse's mouth, so sometimes we'll round those down and get those more smooth. And then again, incisor malalignment. You'll look at a lot of horses that'll have crooked smiles, and that certainly affects their ability to chew. The whole thing is affected by whether or not these teeth are straight across the front. So those are basically the different things that we will look at and address when floating. You can imagine again, and we'll show you when we get to the horse, but we use a full mouth speculum at Southern Indiana Equine, so we will have a horse's mouth open like this, which allows us to access with our hand and the float the entire mouth. It allows you to visualize it as well as feel what you're doing. I think that's a really important part of doing a good job doing teeth. So We'll stop here for now, and we'll go over and get over to Jack and do his dental for you, and we'll go from there. This is Jack. He's going to be our teeth floating victim for today. He's a 14-year-old quarter horse gelding. He is new to his owner, so we're not sure what we're going to find in his mouth. Usually before we start, we will inspect a horse. We'll do a physical examination to determine how sharp they are. He does feel like he needs to be floated. He feels fairly sharp on the sides. Obviously, after you all saw the skull, with your finger, you can only reach a few teeth up front. You can't reach everything back here. So, but what I'm feeling up front, he definitely needs to be floated. And then we will look at his incisors. Again, we talked about incisor malalignment to see if he's got any issues that way. And he looks like he's pretty good also. Kind of is acting like he's going to need to have a second sedation for us to get him floated. We already gave him the first shot, so we'll give him a little bit more and then we'll get started. Go ahead and put the mouth speculum in Jack. And this is a full mouth speculum. Again, when we open it up, we'll have full access to his mouth to be able to see and to feel what's going on inside. First, before we get started, we'll open him up and then we'll rinse his mouth out. The top teeth in Jack's mouth, we've changed to an angled, or we've actually put on an angled float blade that will work on the outside of the tooth. Again, we're going to work on getting those sharp enamel points from the outside, and then work on placing a bit seat again where his bit will sit comfortably in his mouth. So those are the main goals we're going to start with to get things leveled and smooth, and then we'll go to the bottom side. Okay. Take a feel, make sure we've got everything smooth and nice, which I like the way it feels. And now I'll have Shannon take the tongue and go to the opposite side to where I can work on the bottom teeth. We got the bit seats, got a good start on the bit seats, got things pretty level and the major sharp points taken off. Now I'll switch to a rotary blade that's flat, and it has more of a diamond bit that'll polish and smooth the surface of the tooth. I'll go to the opposite side to touch up that bit seat. Okay, got all 4 teeth bit seats addressed in place. They're nice and smooth. We've got our cages level and smooth on the outside of the uppers and the inside of the lowers. Obviously no caps in a horse this age, no wolf teeth, and interestingly enough, no large bridle teeth in him. That probably need to be addressed too much. So we're pretty well finished with his float. And we'll go ahead and get him rinsed out, and his mouth rinsed out and the mouth speculum out, and then we'll finish up our presentation. Alright, so he's done. Probably glad to be done. Feels good. When we're finished, we like to check and make sure they slide good from side to side, that she has very smooth grinding. We recommend floating teeth yearly. Some performance horses or babies, like 3-year-olds that have caps that are losing their baby teeth, we can recommend doing every 6 months. Sometimes if there's a problem, we'll recommend doing every 6 months. But for the average horse, yearly floating will keep them in good shape. With proper teeth care and the current advances in nutrition, it is not uncommon at all for horses to live into their 30s and be active, and performance horses into their 30s. So certainly dental care is a huge important part of taking care of your horse and adequately allowing them to feel good, to be free to perform. So we are always happy to answer any questions anyone has. You can message us on the clinic Facebook page or check out our website at southernindienequine.com. Certainly call the clinic. Our number is 812-754-0341. And if you have any questions, you can feel free to call us at any time. So we appreciate your time. Glad you took the time to listen to this today, and hope you have a good afternoon.